Good morning, doctors. Welcome again. Our today's topic is biomedical waste management. As we all know, this is a very important topic according to PSM. In PSM, in any exam, there is a one question with this topic. If you are leaving this topic tablet, uh, this topic, this folder, this page, that means you are going to lose one question answer in your exam. So please try to revise this table one day before exam. Okay. Now, biomedical waste comes under the Ministry of Forest and Environment. Earlier there is too many categories, but nowadays there is four categories like yellow category, red, blue and white. Okay, according to series, one is yellow, second is red, third is blue and fourth is white. Remember this way. So what to discard or what to put inside a yellow bag, that is infectious waste like animal waste, human placenta and human waste. Okay, for yellow category. But you are going to ask black about. So black, guys, this is not a biomedical waste management, this is a general waste. So general waste. So in case of yellow category we put like pampers, follies, French follies, nasogastric tubes, such yellow category. In red, sorry, in yeah, like pampers, like human anatomical waste, etc. In red category, we put plastic, rubber, tubes, catheter, and syringe. Okay. But in blue category, we are going to put glass material like test tubes and slides of hospital waste. In white category, we put what is okay. We are going to discuss later sharp metals. Okay, understand, I hope. For black it's general, it's a municipal or landfill. Okay, now what to do after if we put something like pampers and some anatomical waste, placenta in yellow category, then we need to do chlorination of that bag. We chlorinate that waste and then incineration occurs. So this is finished. Now we are going to discuss about red category. What we are going to do with red? Red, see here, this way, here. Okay, so red is non-chlorinated bag, autoclave, microwave and radiation or hydrolytic, but never incineration. Incineration for yellow, landfill for black. Okay, I hope we discussed till here. Now about blue. Blue waste like glasses we put inside it, and then near below you see what is blue. We are going to do with blue waste, it's glass, 4% of hospital waste, so recycle after chemical treatment. Okay, now white category like sharp metals, we are going to put in a white puncture proof bag. It is a sharp, so shredding and then recycling of this waste. Okay, now firstly the glass or 4% of hospital waste recycle with chemical treatment. Now see, empty blood bag is yellow, empty urine bag is red. Means a blood bag we are going to put in yellow bag, or empty urine bag we are going to put in a red. Or metal implants, this question asked in UPSC this 2018, blue bag. Okay, or recycle. Sharp category A is fourth, and anterior of infectious waste is 1.5% among the hospital waste, and discard expired medicine in yellow bag. So guys, have a good day, goodbye, that's all for today. If you have any queries, any question, you can ask me, and please revise this.